What's up, everybody? Hi, Lisa. I am pinning our comment right now. Hope everybody's having a good day. Hi, Rama. All right, so I'll get started in a little bit. So today's topic is actually about safe sex and COVID-19. We're going to talk a little bit about safe sex in general, how COVID-19 is spread, and then give some tips about how we can practice safer sex during the pandemic. And so I want to remind you all that over the last few months, Whitman-Walker's Community Health Department has expanded its outreach efforts to social media. We cover various topics about HIV, STI, sexual health practices, access to care, social determinants of health, and general public health interventions. Our series of outreach sessions also focus on the current pandemic, COVID-19, and ways that you can manage your sexual, personal, and mental health. The community health team is here to educate and support you. So again, as I mentioned, I want to talk about safe sex in terms of, HIV, STIs, and about COVID-19 in terms of how the disease spreads, possible symptoms, etc. And also talk about what safe sex will look like during the pandemic, like encouraging masturbation, avoiding close contact, things like that. So safe sex. I personally think safe sex should always start with a conversation with your potential partner. It can be awkward sometimes. We all know that that's the case, but try to approach that situation with a little bit of confidence. If you're confident and you bring it up without judgment, your partner might be open to that discussion, or more open if they see that you are extremely confident and comfortable with having these type of discussions. Also, they could also be just as worried as you are about bringing it up. So you breaking the ice, you being the one to actually bring up the conversation about safer sex practices could be a good thing. Just remember that nearly everyone who is having sex will have to have this conversation at some point, right? And maybe other people before you have already done it, so it may not be as uncomfortable as you might seem. So here's some tips that other people have found helpful with having these sorts of conversations. So a tip is don't wait until, so safe sex, try to avoid. All right, so don't wait until the heat of the moment to start talking about HIV, STIs. It's better to talk about it earlier rather than later. Certainly before you decide to have sex, right? Also, don't force it. Find the right time and place to have that conversation. You can schedule a time to talk to the person or have a spontaneous conversation in a setting where you feel comfortable. Also, it could be a good idea to schedule, if you're in a relationship or have a sexual relationship, try scheduling regular check-ins. We can call these talk bursaries, right? Where it's like a scheduled time where you talk about these sort of practices in your relationship and in terms of your relationship. The key to a healthy relationship is having an open dialogue throughout the relationship. Obviously, it can be hard to find that right time, that right place to bring these things up. But if you agree with your person to schedule them in advance, then no one has to really wonder about timing or when to have that conversation or how to have that conversation, because you would have already planned this out. Also, a conversation does not have to be face-to-face. Whether you talk, type, or text, it is important that you start that conversation, especially when it comes to talking about HIV. So preventing HIV infection and transmission of other STIs are obviously a conversation when we're talking about safer sex. So when we have these conversations, that typically goes towards the use of condoms and the appropriate use of condoms during sexual, practices. So consistent and correct use of latex condoms is a highly effective way to prevent sexual transmission of HIV. Also, this reduces the risk for other STIs that are transmitted by genital fluids that can include chlamydia, gonorrhea, trichomoniasis. Also, it could reduce the risk of genital ulcer diseases like genital herpes, syphilis. Also, make sure that, the exposed site where the sexual intercourse is taking place can be protected, whether that's with a condom or dental dam, if it's oral. Just consider those things in your safer sex practices. Also, HPV, the reduction, condoms leads to the reduction in risk when it comes to the transmission of HPV and HPV associated diseases like genital warts and cervical cancer. So wanted to throw that out there. If you have any questions so far, feel free to drop them in the comments. Also, I want to talk, before we talk about safer practices during COVID-19, I want to first talk about how COVID-19 transmission occurs, just so you have that baseline, right? So COVID-19 mainly spreads from person to person. This can happen between people who are in close contact with one another, quote unquote sex, obviously. Droplets that are produced when an affected person coughs or sneezes may land in another person's mouth or is breathed it through a person's nose of people who are nearby or possibly inhaled into their lungs. So obviously this makes having sexual intercourse extremely risky and an increased opportunity for COVID-19 transmission. A person who might be infected with coronavirus may have no symptoms and may be able to emit these aerosols when they either talk or breathe. So aerosols are infectious viral particles that can float or drift around in the air for up to 3 hours. So another person can easily come into a room, walk by, and breathe in these aerosols and become infected with the coronavirus. This is why everybody should continue to wear masks, and especially when they go out in public. Also, coronaviruses are known to spread from contact with infected surfaces and objects. Although that this is a very less common way for the virus to spread, there is research showing that can actually happen. So, can you get coronavirus from sex? The short answer is yes. All close contact within 6 feet with an infected person can expose you to the virus that causes COVID-19. Whether you're engaged in sexual activity or not really doesn't matter. If you're in that proximity, that close proximity with a person who's infected, then you can potentially be exposed. There is currently no evidence that COVID-19 can be transmitted through semen or vaginal fluids, but the virus has been detected in semen of people who have been infected or are recovering from the virus. So further research is still needed to determine whether or not COVID-19 can be transmitted sexually. However, we do know that traces of the virus have been found in those people who have been infected or who are recovering from the virus. So you're probably wondering, okay, how can I practice safe sex during the pandemic? So the number one thing that we recommend is masturbation. I think we all know that self-pleasure will not spread COVID-19 if you're doing it to yourself. So that is the recommendation right now. So there are some other things that I'll talk about that you could possibly engage in. So if you do live with someone who's in your household, that is your next safest sex partner other than yourself. So consider that as an option. Another thing is avoid sex with anyone outside of your household. I've even heard of people who have created like a pod and they don't engage with anyone outside of their pod. I mean, you could, maybe if it's up to you, I'm not recommending it, but maybe there's a pod that you could associate for your sexual practices. If you make a living from having sex, consider online options instead of face-to-face sexual intercourse. There's video cams and video chat and other websites that you could use to, generate income if you make a living having sex. Also, kissing can easily pass on COVID-19, so maybe that's something you avoid during your sexual practices. Also, rimming and anal play can spread, or might spread, I should say, COVID-19. So condoms, dental downs, and other barriers like saran wrap or, finger condoms or finger cots can reduce contact with saliva or feces. So that might be something you also want to integrate into your practices. Make sure you continue to use soap and water to wash your hands, but not only your hands, make sure you're washing any sex toys that you are using in the bedroom as well with soap for at least 20 seconds. If you are masturbating and you are using a shared resource like a laptop or a computer, make sure that you disinfect those keyboards and those laptops and those monitors and everything else that you might touch or interact with during your session. Just want to put that out there. Also, if you or your partner are feeling unwell, that can include, a fever, a cough, a sore throat, or shortness of breath. Avoid kissing, avoid sex. Also, if you are at a higher risk for serious illness from COVID-19, then you might want to avoid sex altogether. That's probably the best practice for you. Just make sure I'm not missing any. Okay, a question is, do people wear masks during sex to avoid kissing? You can. So the recommendation is to pleasure yourself if you're not having sex with someone inside of your home. However, we all still choose to do what we want. There have been people who choose to wear a mask during sex to avoid kissing. Especially since they're going to be in closer contact. Wearing a mask is definitely more safe than not wearing a mask. So you can wear a mask if you still decide to have physical interaction with someone. But we are definitely recommending to avoid kissing and sex outside of your household. What else? Any more questions? All right, so again, I will remind you all that the safest type of sexual activity during COVID-19 is self-masturbation. You might also consider engaging, if you have a partner in sexual intercourse or sexual activity, whether it's via text or photos and videos, but make sure that you are using some encrypted platform to provide a layer of protection. You don't want those things to get outside of the relationship that you have with that person. Also, beyond sex, there are other ways to create and maintain intimacy with a partner, and you can do that at a distance. You could go on virtual dates together. You could watch movies virtually together. You can share music that you enjoy, write letters to one another. We're going back to the old school now. Or you can dress up and get on, not Instagram Live, but FaceTime to, show off for each other. You can be really creative during this time. So I definitely encourage you all to try out those things. Can I get COVID testing at Whitman-Walker? Yes, you can get COVID testing at Whitman-Walker. So if you are experiencing symptoms, you can get a COVID test, but it is by appointment only. If you need that appointment, you can call 202-745-7000, or you can email appointments@whitmanwalker.org. Any more questions? Let's see. So I am curious to know, do you all know of any more safe sex practices that you've maybe heard of people doing during the pandemic that you've practiced yourself? Personally, I'm sustaining from sex, mostly, I would say. So just to reduce my risk of transmission. And so that's what I'm doing. So I'll be curious to know what you all are doing. Please drop it in the comments. Also, if you are being sexually active with someone outside of your household, we are not encouraging this, but I do consider you to take these precautions to reduce your risk of getting the COVID-19 virus. So Minimize the number of sexual partners that you might have. Avoid sexual partners who might have symptoms of COVID-19. Avoid kissing. Avoid sexual behaviors that have risk of fecal or oral transmission that involve semen or urine. Use condoms, dental dams during oral or anal sex. If you are having physical intercourse with someone, wear a mask during sexual activity. That will definitely help. Wash your hands and shower before and after. I'm sorry, I giggled there because you think that's a given, but who knows? Wash your hands and shower before and after sexual activity. Wash your sex toys, as I mentioned earlier, before and after using them. Again, that 20-second rule also applies to your hands, but also your sex toys. You can use a soap to cleanse those things, or you can use alcohol to wipe things clean, or the areas that you're going to be interacting with clean prior to sexual activity. If you have any questions about COVID-19, your sexual health, including HIV, STIs, and pregnancy, you can call our community health team at 202-797-4439, and we will be glad to answer any questions that you might have. It looks like I have a question. What have you been doing to keep yourself safe during COVID? Yeah, that's a good question. If you have any comments, and what have I been doing to keep myself safe during COVID? So I have been keeping my pod limited to my household. So I have a friend he and I decided to quarantine together. So we hang out, and it's just a friend. It's not a sexual partner. So it's just a friend. So I am sustaining from sex right now. I hang out with my friend. We, hang out and that's it. And then I have also got vaccinated. So I think that's a huge part of helping keeping myself safe, but also preventing the spread of COVID-19. So that's what I'm doing. I'll be interested to know what you all are doing. Are there any more questions? Well, I do want to remind you all that, Whitman-Walker is still open for free HIV STI testing. That is by appointment at our Liz location or our Max Robinson Center location. Our Liz location is located in Northwest DC. Our Max Robinson Center location is in Southeast DC. To make an appointment, you can call 202-797-4439. Again, as we discussed earlier, social distancing is still the best way to reduce the amount of COVID-19 community transmission. So continue to deliberately increase that physical space between you and other people to avoid spreading the illness. Also, stay at least 6 feet away from people. Wear a mask in public. Avoid large crowds. I encourage you to work from home if you can do so. Speak with your loved ones, your sexual partners, your whoever via FaceTime instead of meeting in person, unless they live in your household. Social distancing is a way to care for your community. I'm going to keep saying that because it is extremely important. We all have a role to play in the reduction of transmission here. So stay up to date on your local, state, and national guidelines for testing, vaccinations, and quarantine, and just general safety. There's always new information coming out. So also encourage you all to visit the CDC's website. Like recently we find out that the CDC actually recommends double masking. So you can wear 2 masks, and it should help reduce the possibility of transmission through the mask. So continue to wash your hands for 20 seconds. Follow us on Instagram, Facebook, Twitter at Whitman-Walker, and also follow us at Real Talk DC_ on Facebook, Instagram, and Twitter. And you can follow me. My name is Sir Dave, but my Instagram tab is Sir_Dave_. Thank you all for your time today.